We will begin with the acknowledgement. I'd like to acknowledge territory. We acknowledge with honor and respect our opportunity to live and work within the country, the traditional and unceded territory. Welcome, everybody. I am Pam Beach, and Yvonne Rich, who is standing at that meeting, thought it would be a great opportunity to bring some current information to the community on drug awareness issues. So tonight, that's what we have tried to gather together for you, and honestly, we have expert panel all of the issues, and we are very fortunate and very happy. One by one. And so what we are going to do, a little bit of hosting first here, we're going to have our presenters present. I know everyone's so some as we go through and they come to save them, we'll have a question period at the end when you can people on Zoom. So the Zoom people will be putting their questions in chat, and they also continue to have those questions answered at the end. So on Zoom you'll be muted until the question period is again. Just welcome to this evening, because I think it is an evening for sharing current information, drug use awareness available. We have with us both in person and we have on Zoom an expert panelist as well on drugs abuse, identification and treatment options, responding over to overdoses, harm reduction, enforcement, and community safety, impacts on school cultures, and school district aid and free supports. Most importantly, we have online with us tonight also an expert on living with drugs and in recovery. So I wasn't kidding when I said we have great expertise here. So the knowledge and the understanding and compassion that we need to develop and grow is fast becoming a necessary set of life skills for the general public to learn. Let's get started here tonight. And before we begin, I need to let you know that the event is being recorded. I don't think we're going to try and record the question and answer section because it's very hard to get that. We are going to record the presentations, and so word of mouth, it will be posted up on the Eagle Valley Community Support Society website after the event is over, so that if you run into anybody who was afraid to come or just couldn't make it, they can still take the new information. And so please share that. All right. So having done that, we do have a timer presenter, so she's got a card and she'll let you know.
So we'll be doing 10 minutes, 5 minutes, 2 minutes, and then thank you.
Is there one more?
The vote will come out loud.
I think I covered everything. So I am going to start with our very first presenter, being online, Michelle Monsignor. Are you there, Michelle?
Hello, everybody. Just going, hi. Just going to bring up my screen here.
Michelle,
Yep.
I'll just introduce you. Bio, please, yeah. Michelle has a major in psychology and is a registered psychiatric nurse. She's worked mostly in long-term care, but recently made the transition to the community to pursue her roots in mental health. Now working as a mental health and substance use clinician with the integrated treatment team for Interior Health Board. Welcome, Michelle.
Thank you. My apologies, the audio is a little intermittent, so I am hearing most of you, but it does cut out a little bit, so just letting you know. Am I okay to commence?
Yeah.
Okay, perfect. Okay, just gonna bring up my screen here. Okay, so to dive right in there, we're just going to get into the common illicit drugs and their physical and psychological effects. Just a heads up that, you know, some of the consequences of these drugs can be a little alarming and maybe a little triggering for some. At the end of my slide, I will have some references and resources that do have links to access mental health and substance use services, and that will be posted in the chat. So crack cocaine is a stimulant. It can be very psychologically rewarding because it's a mood altering drug. So it changes the way a person feels. For example, if they have negative or sad emotions, it can help numb that. It is an intense high and is short-lived and followed by the opposite emotions. So then they can then experience intense depression, edginess, craving for more of the drug. They may begin to not sleep or eat properly, feel paranoid, angry, hostile, anxious even. So physically what it does is it really accelerates the heart rate, brings up the blood pressure. It speeds everything up to give that, you know, euphoric effect. Side effects of that can be racing heart rate, muscle spasms, convulsions, and even cardiac related deaths. We also have heroin. That's a semi-synthetic opiate. Surge of euphoria and pleasure, and that can be followed by sedation and tranquility. That can be often be described as a warm blanket on the brain. So it's easy to see how that can be a psychologically, you know, addictive component. Physically, they may feel, you know, that, or emotionally, that detachment. And from the emotional pain, often that can be past trauma. And this can be for most drugs, but especially for this one, brain scans will show that long-term use of this drug actually changes the neural pathways in the brain, and we'll actually see eroding of gray and white brain matter. So this can affect decision-making capabilities, behavioral control, ability to cope with stressful situations. In the beginning, you know, they have that sense of well-being and happiness, and then everything slows down in a sort of like a dream-like state. What's happening is the heroin is slowing the heart rate and breathing, which is ultimately the reason for death during an overdose. Methamphetamines or amphetamines are also a stimulant. Physically, a person can experience a powerful rush, burst of energy and confidence. However, when that wears off, they can experience they can experience nausea, restlessness, depression, sweating, shaking. Risks can include sores, dental problems. It can induce psychosis. They can experience rapid or irregular heart rate, liver failure, or cardiac arrest. Benzodiazepines are a sedative. So this ultimately slows brain activity in the nervous system. It's quite dangerous to use with alcohol as well, as it's a depressant, so that can lead to respiratory failure. Has a very drowsy or calming effect and can also cause confusion, disorientation. It can make people unsteady on their feet. So that's a big risk for, falls and accidents, slurred speech, slower reflexes, slow breathing, low blood pressure. Withdrawal symptoms can include tremors, vomiting, headaches, anxiety, panic attacks, depression, and may also increase suicidal thoughts. Another common illicit drug is hallucinogens or psychedelics. This causes distortions in the way that the person will perceive things or actually see things, hallucinations. It creates a dissociative feeling and produces changes in perception, mood, cognitive processes. So, the senses, sense of time, emotions will be affected. It can also cause impaired motor skills. So you definitely, they wouldn't want to be driving or anything like that would need focus. It can cause heart problems, psychosis, depression, cognitive damage, especially with long-term use, seizures and coma, again, to name a few of the physical effects. We've heard a lot about, a bad trip, can be very scary to some people and have them react in dangerous ways sometimes. So a little bit alarming. And toxic additives is the next topic. And if, the consequences of some of these substances weren't scary enough, toxic additives are being added to the local drug supply. It's becoming increasingly toxic, and it's the biggest cause for the skyrocketing number of overdoses that we're seeing. So statistical reports on deaths in BC is where I got some of the information for this. And I decided to focus on the additives that completed drug toxicity deaths rather than just overdoses. So one of the common ones that we've heard is fentanyl. This is an opiate and it's 100 times more powerful than morphine. It's used to cut heroin and other street drugs to make them stronger, cheaper, more addictive, and definitely more lethal. In toxicology reports from 2021, it was detected in 82% of all the drug samples. Carfentanil, which is an analog of fentanyl, was present in a lot of those samples as well, and almost triple the number recorded in 2020. So things are becoming increasing every year. Benzodiazepines is also, it's a common street drug, but it's also used to cut drugs. And last year they were positive for atezolizumab. And atezolizumab is very sedating and can cause serious respiratory depression. This also creates significant challenges for life-saving efforts from first responders when they come to the scene and they go to use naloxone or Narcan. It does not reverse its effects. Stimulants are inexpensive and readily accessible, so they're often used. They can include caffeine, aspirin, amphetamine. And as we know, they speed up the central nervous system, and some of those effects can cause seizures, coma, and death due to burst blood vessels in the brain. Xylazine is sort of a new one that's come in to the scene. It's called trank dope on the streets, another toxin found in the drug supply. This is actually an animal tranquilizer. And scary enough, it's also associated as the flesh-eating zombie drug because it causes skin rot from the inside, leading to gaping sores and on the body. It's a sedative and it's not an opiate. So again, it's not going to respond to Narcan. If you look at the photo below, this is Burrard Bridge in Vancouver. The shoes along the bridge are tied with a purple ribbon, and that marks Overdose Awareness Day on August 31st. These efforts were coordinated by Mom Stop the Harm, and the shoes represent the number of those lost to overdose in BC for the months of May, June, and July of 2020. Signs of an opioid overdose. We use the acronym BLUE. So often you'll see with breathing, and this depends on where in the timeline the person is in their overdose, but their breathing may be very shallow. It also may be very erratic. You may hear some gurgling or just no noise at all, just absent breathing. The lips and fingertips are going to be gray or blue, and this is indicative of, lack of oxygen. They're going to be unresponsive generally, not waking to verbal and physical stimuli. And their eyes are going to be pinpoint pupils. And that's, again, a sign of opiate overdose. I did include in the bottom other substances because, of course, depending on the substance or drug that's being used, the overdose may look a little bit differently. But for other substances, you can see things such as choking, vomiting, cold, clammy skin, difficulty walking, talking, staying awake, confusion, just, sort of odd, erratic behavior. And the next topic, identifying drug behaviors versus mental health issues. So this is a fairly tricky topic because the relationship between mental health and substance use is quite complex because they're often concurrent, they go together. People with mental health issues often use substances to cope or self-soothe. We've heard the term self-medicate. So when people find relief from their psycho-emotional pain and hardship, it enhances rewarding effects of those substances. It's the psychological addiction component, making it more likely that they're going to use them. On the flip side, using substances can actually exacerbate or cause a mental health disorder because over time it changes the brain structure. There's rewiring that's happening, so it makes it more likely to develop one. This is yet another reason why SUD or substance use disorder should be viewed as a health or medical issue. So it makes it pretty challenging to make an accurate diagnosis because a lot of these symptoms overlap. For example, when we talk about psychosis, that it can occur in mental health orders such as bipolar or schizophrenia. At the same time, if someone has taken certain drugs such as meth or cocaine or psychedelics, that can also induce a state of psychosis. So in these comparison boxes here, you can see there's so much overlap between common drug behaviors and common mental health behaviors. We're going to see a lot of interpersonal difficulties in relationships, understanding or relating to other people is going to be common. Paranoia can be seen in both. Mood swings and mood changes, whether they have substance use issues or mental health behaviors. You're going to hear people say they're just not acting the same, not acting themselves. Withdrawal is going to be another one. You're going to see isolation, withdrawing from common hobbies or social activities that they used to be involved in. And overall decompensation. You're going to see, neglect of responsibilities at work and home, with themselves or their appearance. You're going to see that on both sides. I think that with common drug behaviors, one thing that might stand out a little bit more than mental health behaviors is around money. So there might be a little bit more unexplained for money and financial problems, a little bit more, borrowing or stealing money. But overall, just coping. You're going to see a lack of coping with daily activities or ability to handle daily problems and stress. So that being said, this highlights the importance of using comprehensive assessment tools because the presentation of these behaviors are really going to look the same, or they can also look different depending on the type of substance they're using or the type of mental health. So it's really important to use good substance use disorder and mental health assessments that are going to reduce the chance of a misdiagnosis and, more importantly, provide the appropriate treatment. Treatment options and access. How can we help? So there's a spectrum of treatment options and modalities that exist for substance use disorders, which is why it's important to speak with a health professional to help determine the most relevant path, especially when there's a lot of variables, individual situation, and those concurrent challenges of combining mental health issues as well. So here are a few of the treatment options. Detox can be a crucial part of treatment. However, it is important to note that detox alone doesn't have a good success rate. In fact, it does have a high relapse rate because it's sort of like putting on a Band-Aid without, treating the actual wound. So rather, detox should be supplemented with psychosocial treatment and counseling that's tailored to the root reason or the core of the substance use. Treatment centers can often accomplish this in a more holistic fashion and can either be inpatient or outpatient. Some are even culturally meaningful. So we have a lot of First Nations treatment centers. And most offer a range of counseling services, including grief or trauma. They're staffed with trained professionals and offer a variety of groups to attend. So following that comprehensive assessment that takes place before entering a treatment center, a treatment plan is person-centered and tailored to meet that individual's needs. OAT is another treatment option, and that's opiate agonist treatment. And this is a medication-related treatment. So this involves taking medications that assist or wean to replace those illicit opiate substances. Many do find this preferable to detox as it helps alleviate those dreaded symptoms of withdrawal. And in addition, when seeing the OAT provider, they really can do a good job of providing connections with them to other services, making for a more rounded treatment journey. Health clinics and health authority are an excellent resources to gain access to these services. Locally, we have IHA at most of our health centers in town, and this process involves a quick intake or questionnaire, either in person or by the phone. A referral is then placed for services for the most appropriate health professional or team. There are many different disciplines at a lot of the health clinics, including mental health and substance use clinicians, social workers, counselors, treatment support recovery workers. So all one has to do is reach out to the health clinic to be able to get connected to a range of these supports. CMHA has an app for those in crisis. PACT, which is an acronym for Peer Assisted Care Teams. It's the aim of the PACT is to provide an alternative to police and everything. If you just wanted to have a shift to community-based crisis care that's client-centered, trauma-informed response, and getting the well-being of the infected individual, their family, and their community, which is taken from the PACT website. In my references page, there is also a link to the PACT. Despite whatever treatment modality anyone chooses to go with, an important factor is sustained engagement. So we know that ultimately, the more that you're consistent and involved, increases those chances for improved health outcomes. So that wraps up my portion of the presentation. So I will hand it over to the next speaker. Thank you very much.
So I'm not sure Jeff Conner here to actually can talk about the other types of drugs. I'm not sure. Yeah.
Thank you. Thank you for that introduction. Admittedly, one of my community disruption, many other issues, alcohol is really a significant issue that due to our culture we allow quite well. For example, when you talk with detox, the only drug you die on without detox properly is alcohol. And alcohol in BC, for example, is 2,600 deaths a year. And we make money off of have this conversation and stuff with the audience. But we also have a deficit of almost $800 million from treated police resources, other things.
Sorry, Jeff, I would interrupt.
Yeah.
I need everyone to speak up because the owl's not picking up, and then our folks online are having a hard time hearing. So just everyone on the panel, and pardon the interruption, but
We're good.
everyone's like, help us, we can't.
Yeah.
Thank you.
Can you hear me now? Might need to move the speaker a bit closer.
Yeah. Here, maybe you can just pull it forward. Yeah.
That feedback brings, in libraries. and such. So really my thing is, I have some research about, think about the legal something. All drugs have one continuum. And we have the opportunity regulate, not just municipal level, but federal intervention, and how we choose to do that, choose some of the options. You know, one example I'll give quickly just about myself, move on to, unfortunately, there. I had my first time experience in long. I was going to get home to speak. And so they gave me fentanyl and benzos. Really interesting. But what was even more interesting, they call it conscious sedation for a reason, right? And so, and my son had a really major issue with violence where he's in ICU. And fentanyl really helped him in the situation. But what was even more interesting for me at some level was before I was able to do my colonoscopy, I had to get this like a plumber. But I couldn't get it unless I went to the pharmacy with a note that I needed it because people would use it for other reasons. So we have a whole continuum of opportunity for drugs and how we can regulate them. And so I want to move us to at least open up to think about the different ideas, but away from black and white, legal or illegal. Think about, for example, cannabis. You can only get so much of it in stores that only sell that. Lots of warning labels on it, lots of stuff. It's a public health measure. Alcohol, you get as much to kill everyone in the school. Anyone here could go to the liquor store here and get enough to do that. Tobacco is sold in every corner store. There's no warning labels on alcohol. It causes cancer. Why is that? My bubblegum has warnings on it. My water has calories on it for some reason. So I think we need to think a little bit more broadly about this. Legal drugs, of course, are an issue. We talk about why they're illegal, which is probably a bigger issue that might stay away from this conversation today. But I think that looking at the legal ones as well, once we throw those in there, we have drugs that are very dangerous that we manage. Legal ones are a big part of that, and for a culture that allows that or not. Now we're going to talk about overdose deaths and some other ones, but I'm sure other people who work in first responders can talk about one of the ones they get and how they play out versus things like cannabis. Is cannabis a problem for early psychosis for some people? Probably. Psychosis gone up with cannabis use? No. So is it related? Kind of not really. So I think for me, it's around the legal stuff to think about that as well. Oh, we're talking about drugs. Me, drugs are drugs are drugs. And part of my thing is about the burden of disease. That's what I'm interested in. And prevention. And one of the best ways to do prevention is through policy. And that's why I'm really happy about having community here too, because as much as detox is helpful and treatment's helpful, having a supportive, caring community is the difference. That's it for me.
Thanks.
Yay.
I'm gonna respond to Jeff's for a minute because this is perfect. You just promoted what our next sort of effort in terms of education was going to be. All the others, everything else, right? So you'll be back.
Good for me, I don't know about you.
So thank you, yes, point well made, but we have to start somewhere. And
absolutely.
it's the
Yep.
flavor of the day
Yep.
right now. So, we are going to move on to, a safe, response. And we've got paramedic, Susie Cameron here to present to you. Susie?
Hi, I'm supposed to be Kathy, well, actually, it's supposed to be me, and then it was gonna be Kathy Kravenmeyer, and guess what, here I am. She's doing training for the houseboat rescue, so, and she's the only one that does it because I'm right now working at a Salmon Arm, so I can't do that. I've been with BC Ambulance Service for over 30 years now. I started off in Revelstoke, and I've always been in a small community. I transferred overseas to Camoose in 2010. Scooped a full-time position last December in Salmon Arm and excitedly coming back on June 1st here back home in my town. So with that said, seeing the overdoses on the streets, with their buddies and whoever else, and nobody wants to go to the hospital. You'll get called out for dealing with the cardiac arrest overdose, you'll get called out for the hypothermic overdose, depending on where they are. We had one of those last night. Buddy couldn't wake his buddy up, so he stuck him in the lake. It's a little cold to leave him in the lake right now, so when we got there, he was kind of blue, so he was going to the hospital whether he wanted to or not. He's not in good shape, don't know what the outcome is. It wouldn't look good. My role as doing prevention is to help do some training. And after working as a community paramedic for 5 years, doing training with AEDs and CPR, and having the chance to do the naloxone training and share the kits. I've done 4 training sessions here now in Sycamoose. I did one with the volunteer fire department. I made sure that I got the guys on the rescue truck, as well as I went to the music festival last summer, and any of the volunteers that wanted training, I gave them, I supplied with them some kits that we can get. We hand them out like they're candy in Salmon Arm. If someone's used one with their buddy in Tent City, then they get another one. Whatever we can do to help stop the circle of people dying, and I know it's a disease. It's a tough one to face. I also did a couple of the bartenders in town because some of the bars are getting busier and they wanted to know, and they have them behind the bar. So that was kind of nice. And when I get back here, I plan on doing that. And I'm pretty sure that Kathy and I will be doing that together. It's not a hard thing to do. It's actually quite simple. You get 3 doses in these little vials. You get 3 syringes that once you click the button after you shoot it in their arm, the needle goes inside. So it's pretty much safety proof. You just push till it clicks. There is a mouth guard if you choose to give respiration to breath to this person before you give them your medication. That's totally up to you. Not my idea of that. I have here, and I'll leave these here for everybody. It is the Safe Steps to Save a Life through the Towards the Heart website put on by the BC CDC. And it's one of my favorite websites as far as prevention and harm reduction. They have several videos on how to, they have resources, they have a list of different things available for you. There's actually an extended training program on there that I think I might just jump in and join and see how that goes over. And yeah, so it's kind of been my passion. Stepping into that community paramedicine program put me so much closer to the community that it's just, I'm not ready to quit yet. Soon, but not yet. It's yeah, it's great working with the public. It's great being able to support them, and the medical field in my life, 2 generations has sort of kept me going. Pam and oh geez. Janet know my mom really well. She was a retired nurse. Sorry, Janet. You were leave for 6 months, you don't remember anybody's name. So anyway, to be here and part of this community is wonderful, and I'm so looking forward to coming back and being able to more. So thank you for having me.
Thank you, Susie.
I won't be here for questions.
Thank you. We can hardly wait till you get back. All right. So moving on, then we will have Heather and mine. I don't know how you have it divided up, but take it away. Introduce yourselves. Harm reduction.
All right. Hello. Thank you for having us. We're from the harm reduction team. My name is Heather Lee and I work with youth. I'm Mayan Kufak and I am the regional harm reduction coordinator for the Thompson Care Group. Yeah. And I have to say again, thank you so much for having us. It's really warming my heart seeing so many members of the community come together from a place of compassion. And even just hearing you know, like bartenders and in the community that want to help as well. This is very, very special. So very excited to be a part of it. Try some. Oh. Right, hop on. You gave us a territory acknowledgement and I wanna, yeah, just really be grateful for where we are today. And in terms of harm reduction is we're just taking a moment to really appreciate just the ongoing trauma that is happening, and the work that is done. And, yeah, hope to be a part of it. I'll let Maya take it away.
Okay. So I was just gonna talk to some of the statistics. So when we look at why we're here today, the toxic drug crisis, since 2016, a public health emergency for the toxic drug crisis was announced, and 7 years later, we're still seeing too many premature deaths. The deaths due to toxic drug poisonings have become the second leading cause of death in BC. In 2022, there was 2,272 people who passed from drug poisoning. When we look at the statistics for this local area, so the local health area or LHA, there was 12 overdose deaths. It was actually 13, sorry, the slide was not dated there, but it was actually 13. And so far this year, there have been 3 in the local health authority. So when they say local health authority, they're basically putting Sicamous together with Salmon Arm and lumping those numbers together. And the reason that they do that is often due to size and confidentiality of the information that is shared and things like that. So, since COVID, the number has jumped to 12.67 deaths per year. Where previous to that, it was only 3.4. So you can really see an increase in what's happening. And then when we look at, sorry, that's a little. I think they're cut off there. They're a little cut off, it's okay. So when we look at who this is happening to and the demographics, 72% of the people who die from drug poisonings are in that 30 to 59-year-old age category. 82% of those male. First Nations people are disproportionately represented. Although First Nations people are only 3.3% of the population in BC, they comprise of 14% though of those dying, and so are therefore dying at 4.8 times the rate of other BC residents. And then 12% of those people were homeless at the time of death. So then when we look at the statistics of where it was happening, where these overdoses are occurring, 85% of those occurred inside and 14% outside. So of those 85% that occurred inside, 55 were in a private residence and 30% were in another residence. And if you look at the income of the people who have passed, 35% were employed at the time, and 44% were on social assistance. And of that 35% that were employed, over 50% were in the trades. So transport and equipment operators and the trades. So there is some, targeted, I'm losing the word, targeted campaigns going to certain populations, including the trades. Thank you. And so there's something called the tailgate tool. Excuse my words. That is targeted to sort of hit at the managers and trying to get some education out to people who are working in the trades around overdose. So maybe just going back to that slide, and I think, one thing just to say there is that these stats don't really support the idea of that typical drug user being sort of someone on the street, someone, using needles. And most of the overdoses are being caused from inhalation. So just something to kind of challenge some of those beliefs that people may have about who's actually being affected and what that looks like. Okay. So we do have 2 leads for decriminalization from Interior Health, but they were not able to be here tonight. So I'm going to speak to just decriminalization. So in May of 2022, Health Canada granted BC an exemption to the Canadian Controlled Substances Act to decriminalize people who use substances implicated in the toxic drug crisis. So the exception came into effect on January 31st, 2023, and it's to continue for 3 years. And so what that looks like is basically the exemption applies to adults who are over 18 years of age. It includes opioids, crack, powder, cocaine, methamphetamine, and MDMA. And that allows people to have basically 2.5 grams of that substance in their possession, and then, of course, with police discretion above. And then, so with this exemption, basically, there will be no arrests or seizures for personal possession under that threshold. No fines, tickets, or other administrative sanctions, no mandatory treatment or diversion. So instead of fines, basically, police will provide resource cards with information on local supports and will make voluntary referrals. And then just the exceptions to the exemption. So it's only for personal use. It does not apply to K-12 school premises or licensed childcare facilities. It does not apply in airports, on Canadian Coast Guard vessels, or when in a motor vehicle or watercraft. And so what decriminalization does is, or what it doesn't does, is it doesn't legalize drugs. They do not expect it will increase drug use, and that's based on evidence from other jurisdictions that have implemented similar initiatives. But it also does not impact toxicity of drugs. So those drugs that are toxic will still have the same toxicity. However, it will hope to reduce the risk of drug seizures, arrests, criminal charges, and convictions. So the goal of kind of changing from criminalization into more a public health issue. So when we look at why decriminalization matters, so it's basically reducing barriers by shifting the approach, as I said, from substance use to a health matter, not a criminal justice one. So the hope is it will reduce stigma around substance use, so people feel comfortable reaching out for help, and it will support open communication and collaboration between care providers and patients. So someone who, you know, previously may not disclose to their healthcare provider that they use substances or have substances on them for fear of, you know, stigma or criminalization, may be more receptive to seeking out services and help. And so in my role, so my role as a harm reduction coordinator is, and I'll just speak to harm reduction for a minute first. So harm reduction is an evidence-based policy that keeps that aims to keep people safe and minimize death, disease, and injury from behavior that involves risks, such as substance use and sexual activity. So it's shown harm reduction has proven to reduce harm such as infections, injuries, and death. It's proven to increase social and vocational functioning, and it's proven to reduce public disorder. And so the harm reduction services that are provided through our program is supply distribution, drug checking, safe needle disposal, stigma reduction, and overdose prevention and treatment. So in my role as a coordinator, often, you know, we're looking at helping sites to get set up. If they're a site that reaches out wanting to get set up with harm reduction supplies, then we're going to connect with them and go through the process of getting them able to distribute some of those supplies and make sure that they have the education and training that they need. And then drug checking, we also in Interior Health are setting sites up with being able to get set up to distribute the take-home fentanyl test strips so that they can have their drugs tested as well. Those are sort of some of the normal things that we do in this role. Also wanted to touch on drug alerts. So there is a drug alert system, and I know that Donna has brought some cards and left them on the back table as well. But to sign up for drug alerts, anyone can sign up, and they basically just text the word join to the 253787 or alerts number. And that system is a real-time messaging service, so people can they'll receive alerts that come through, but they can also put information back into the system as well. So if they're noting that there's a toxic drug in the area, they can put that into the system and then get that alert, get sent out that way as well. So the drug alerts are all posted on towardtheheart.com as well as on the Interior Health website. But it's a great way of getting the messaging out there of what's being seen locally in the supply. And then when we look at Sycamore specifically and some of the harm reduction services that are set up currently through public health, they do carry a wide variety of harm reduction supplies, so safer sex supplies, injection and inhalation supplies, as well as take-home fentanyl drug testing strips and naloxone kits as well. And then Eagle Pharmacy also carries harm reduction supplies and naloxone kits. The nearest OPS or overdose prevention site would be Kamloops or Vernon for this area. And then I'll just pass it over to Heather.
So I'm going to shift focus a little bit and we're going to talk about youth. So when we're talking about youth, we're looking at a demographic of 24 and under. So why harm reduction for youth? You know, I'm going to kind of reiterate a lot that you said, but unfortunately for me, Jeff went first. He's also far more eloquent, so I'll do my best. But I think it's quite important to just remember that substance universal phenomenon. You know, most of us use substances, and it's not uncommon for you as well. Again, substance use does not always cause problems. It doesn't always lead to dependency. And depending on what it's being used for, like a fun time at a colonoscopy, you can have some benefits. And like Michelle alluded to as well, is that, you know, it's important to remember that substance use at any level does have the potential for risk. So that's where harm reduction is just trying to minimize those risks. It's often viewed along a continuum, which you can see at the bottom there. So like adults, youth vary in their experience with substance use, as well as their readiness to change. So while in some cases, like an abstinence approach works really well for some, that may not work for all youth. And research has shown that youth really, you know, they perceive harm reduction approaches as a bit more helpful and a bit more practical than exclusively looking at a abstinence approach. So it's also one thing I really want to make clear is that harm reduction approaches do not encourage drug use with youth. What it does, it presents like the real risks of using a substance, as well as providing the information about how to reduce those they are to be using, and then to provide support along this entire continuum. So just speaking really briefly to trends, the information that you hear comes from the Mercury data, which is that's done in BC with all schools. So did it yeah, if you're ever interested, you can find all of the information online. They do have a new one coming out for 2023, and we should have that new data soon. It'll be really interesting to see what the changes have been through COVID. But these are the most recent stats that we have. So, you know, when we're looking at what youth in BC are using, it hasn't changed a lot in that alcohol and cannabis have always been the top two. But one that we are noticing is a rate of using prescription pills without a doctor's consent. So basically a misuse of prescription pills. Where that becomes concerning is that if youth are mixing that with anything else. So if you're thinking about, you know, this could be a drug that is a depressant, you're mixing that with alcohol as well, then you really run the risk of combining a lot of those together, right? So again, it's that education for youth to be able to know what those risks are. This is also an awful slide. It absolutely breaks my heart, but it's important to talk about. The most recent,
the numbers and how many there were.
everything. This is the most recent BC Coroners report for January 2023. And so although you 19 and under luckily don't have, you know, they don't contribute a large number like some of the other age demographics, you really have to think about how huge that loss of life is. And when you consider the years of life that are lost, the impact on family, on friends, on communities. So even one death is absolutely tragic and completely preventable. And this speaks volumes to just that need for evidence-based and realistic education for youth. So what does our team do? This fall, we did a big survey of all the schools within Interior Health, looking at grade 7 and up, just identifying, what's going really well with substance use education. What are some of the needs? What are some of the gaps? What are people needing within the schools? And it kind of came back pretty resounding that a lot of the themes were like an interest in healthy policy development, evidence-based curriculum, and some staff training. So what our team does is just that. So we provide training for service providers that work with youth. We do workshops on responding to the effects of substances as well as naloxone. You should be very proud because School District 83 took the leap and they were the first ones to have all of their administrators trained with that. So that was really cool to say. And yes, and again, I think that speaks volumes to your community. So you should be very proud of that. So again, that's with our Blue Kit program where we train school staff on how to use naloxone, and they just have that as part of their emergency response within the school. We also do consultation substance use education. We have some program recommendations, lots of resources, and then some curricular aligned resources that go with the BC curriculum. So we have Safety First, as well as Safer Partying. And then we also facilitate youth access to harm reduction services. So, a lot of harm reduction services that are out there are more adult specific and may not be appropriate for youth to access. So it's looking at where are safe places for youth to go to talk. Slide after that. I'll just speak really quickly. I think, at the end of the day, regardless of what different perspectives or practices are, we all want to save lives. That's why everybody's here. So, from our services within harm reduction, by supporting the professional practice of others with skills, we aim to create more safe spaces for specifically youth, where they can talk openly about substances, again, access those needed services, and ultimately work on reducing those harms. If youth connect with someone and continue to return to ask questions, or if they're in crisis, that's life-saving right there. It doesn't matter where or who it's with. And, a lot of times youth, they avoid institutionalized or medical care approaches, and that could be due to trauma or to fear. And though we may all come from the best place, we may unintentionally push those people away. So, at the end of the day, we need to think about what draws people in, what makes them feel safe, and try to keep them engaged, because as soon as people are disengaged, that's when they run the risk of overdosing or using alone. So just looking at our practices. So just a links here as well. And if you ever needed to get hold of us with harm reduction, whether it be youth or adult, we do have one email address, so it's very easy to find all of us, and we'll just direct you to the right place. As well as one specifically for decriminalization. It's new, there's lots of questions, so always feel free if you have any questions regarding that. Anything you wanted to add there?
No, I think as mentioned earlier, the Toward the Heart website is there as well, which is a great resource that through all the harm reduction supplies as well as training, and it has drug alerts there as well, as I mentioned. So the interiorhealth.ca website is also a great resource with a ton of information there. And please, we are happy to support with whatever we can. If you reach out to us through those emails, we will get back to you right away. Thanks for having us in your community.
Thank you, Heather and Mayanne. That was very informative, and we'll have these resources posted so that for sure people can have access to them. We'll move on then to welcome Sergeant Murray McNeil to talk about enforcement in the community.
Okay. Kelly, you can start my slide. You have that?
I'm gonna share the screen here.
I'll introduce myself. Well,
organized, you got us here ahead of time.
Kelly helps me out in the district meeting. So my name is Murray McNeil, as Pam said. I've been the sergeant here in Sycamoose since 2016, so quite a while now. I started out in Revelstoke along with Susie back in the day. She remembers me when I
Oh, yeah.
was much younger. We've changed since.
Yeah. Brandon Meyer says, I want to introduce you to our new staff sergeant. Turn around, and she says, this is Sergeant Murray McNeil, and I just about peed my pants.
So I've been in the RCMP for 23 years now. Susie's got 30, but I've been here for 23. And yeah, throughout my career, I've been in different stages or jobs with the RCMP. One of those jobs I'll speak about here once we get the slides going. I was part of a street crew unit in Kelowna around 2006, 2007 type of thing. And at that time, the city was experiencing a lot of drug use. There was a homeless issue that was coming up in the city, and we became kind of front and center on that. So I have some experience with what was going on at that time. If you can back up, Kelly, right to the beginning. Yeah, that's fine right there.
This was the first slide.
Just go to the next one. So, yes, the Controlled Drugs and Substances Act, there was an amendment under 56 sub 1 where the province of British Columbia made a request to the federal government minister to suspend the prosecution, make the decriminalization of certain illicit substances in the province. As stated, it was for 3 years. And that became in effect in May of 2022. What hasn't changed is what we're doing as a police didn't make a big drastic change when decriminalization came in. If anyone was thinking that it was going to be night and day, it wasn't. The reality of the facts are, and the province has for quite some time, for the majority of my career, and certainly since 2020 on when it became policy, was that they were not wanting people to be charged criminally with possession of small amounts. It wasn't something the courts wanted in the system. It takes a lot of time to prosecute these cases. It takes money, different resources, etc. And there were other matters that that were being brought forward into the court system at the time. Now that doesn't mean that that these substances are decriminalized, meaning they're still remain illegal. It's illegal. All these substances are still illegal. Just in smaller amounts, they've been decriminalized. So, as I said, when I was part of the street unit in Kelowna, were we arresting people for possession? Yeah, there were times when we were arresting people who were in the city park, etc., who were in possession of smaller amounts or sometimes larger amounts, but we were not forwarding them for charges and prosecution through the Crown. The Crown wasn't interested in charging somebody for having 2 grams of cocaine on their possession back in 2006 in City Park. It just wasn't reality. So some people may think that that was reality, that when the decriminalization came in, that there was a huge shift in what the police were doing. That's not the case. Hold on to, I guess the scope of the exemption has already been covered here by harm reduction. As mentioned, it remains illegal to possess the decriminalized substances on the school premises, childcare facilities, airports, Coast Guard facilities, and in a motor vehicle if it's operated by a youth. Youth is somebody 18 and younger. It's also illegal for an adult to be operating a motor vehicle, a boat, an airplane, if they have the decriminalized drugs within arm's reach, easily accessible. So we, the police, if we find someone operating a motor vehicle and we stop that motor vehicle and there's decriminalized drugs within reach of that driver, that's still an illegal event. We could seize those drugs, whether it's 2 grams, 2.5 grams, 10 grams, those drugs can still be seized. And then there's of course provincial legislation, which allows us to deal with any intoxicated drivers. So that still occurs. Kind of mentioned that in the exemption, conditions of exemption slide that Kelly had shown already. Leading on to enforcement in public consumption, that's this slide here. That's where you're seeing a lot of this in the news. There's different communities, including Sycamoose, that have decided to tackle this issue. Within Sycamoose, I brought it to the attention of mayor and council. and said, hey, with decriminalization coming up, wanted the council to be aware that within the city park, beach park, within the different parks in the community, that we, the police, if we encountered somebody who was openly using these decriminalized substances, that we could not take any enforcement action. We couldn't tell them to leave the park or anything else. We certainly couldn't seize the substances. So there's been different communities, as I've said, that are in the news about that. Campbell River was the first one. Sicamous has addressed it. Kelowna and Kamloops, and I believe Penticton are also looking at that as well. So the local bylaw was discussed here by mayor and council. And that bylaw, it doesn't have any monetary penalties. So we, the police, the bylaw passed in Sicamous, if there's use within the public parks, and it's the parks that the bylaw covers, I mean, the beach park or the park by the rink. If we find someone openly using these decriminalized drugs, we can escort them out of the park and tell them that they're not to be using in the parks. We're not even, we don't even have to seize those drugs. Like if it's under 2.5 grams, we can just move them on, but we have the authority to do that. Whereas if there wasn't a bylaw, then you don't have the authority to do that. And you see on the slide, it also covers private businesses, other areas, like hockey rinks or malls, anything like that. They could all come up with their own policy as to what they want to deem acceptable or permitted within their premises. Next slide. There's one on here about I think we've covered that, applying to adults 18 years of age or over. No fines or tickets. Yeah, you can go past that one. They covered that. There's one on there I put about what was going on in Sicamous, the stats in Sicamous. It was a request for me to speak about that, so you got that one, Kelly. Yeah. So as I said, there hasn't been a robust number of charges going through. Here you see 2017 in Sicamous. That's pretty much when I came here. We've had 10 cases of possession of cocaine since 2017. 10 cases. Okay. Only 3 of those were forwarded to the Crown where charges were approved. Okay, out of the 10. We're talking about cocaine here. One of those was a stay of proceedings. So the Crown decided that they weren't even going to proceed with the charge. And the other 2 cases, they were both related to something else, something more serious crimes were occurring. One was a person was convicted of trafficking. And the second case, they were also convicted of flight from police and prohibited driving. So there was more going on than just someone was in possession of a couple of grams of cocaine. There were more bigger criminal events coming on where that person was arrested, they were searched, the substance was found, and we were prosecuting a larger case. See 2 cases of heroin, both are no case seizures. So that heroin was seized before decriminalization. There were no charges against anyone. 8 cases of methamphetamine since 2017. No case seizures for possession of all of those cases. No one was charged with possession, pure possession of methamphetamine since 2017 in this community. So we had two files worth mentioning. 2019, we had a trafficking conviction for methamphetamine. Notice I said trafficking, not possession. Trafficking of these substances remains illegal. And that person was also found guilty of possession of cocaine and fentanyl. So they had smaller amounts of cocaine and fentanyl, they had a large amount of methamphetamine. And that person received an 18 months conditional sentence order, which means they didn't even go to jail. They received an 18-month sentence, which was served in the community at their residence. So they weren't physically locked up or anything. And then 2022, we had a recent case where a person has just pled guilty to possession. They had heroin and fentanyl, meth and cocaine, and they have yet to be sentenced. So they've entered a guilty plea, but it hasn't gone through the whole system yet. So that shows you the actual what's going on in Sicamous. Like, and as I said to Mayor and Council when we were talking about the bylaw, I wanted to paint the picture to Mayor and Council so they understood that we, the Sicamous RCMP, we're not having an issue presently with people openly using in the parks. That's not the case. The concern was to Mayor and Council, if this happens, then hey, we can't just escort people out, or we can't deal with that without a bylaw. So I was bringing that to the attention of Mayor and Council for them to consider, as has occurred in other communities. for them to consider whatever bylaw they may want to pass. And you can see, the concern that, some of the communities would have. I mean, the province has stated that no one is to be using the substance in schools, in daycare facilities. But in some of these parks, they're heavily used by youth. The beach park in Sycamoose in the summertime, there's all kinds of kids there. And even by the rink, I mean, we have a playground, which I see kids around all the time. So that was the spirit of what the district was focusing on when they were considering their bylaw moving forward with that. So that's my contribution.
Gotta go for it. Oh. Yeah, thank you, Susie.
Yes.
Welcome. You'll be back, I know.
Yeah.
Thank you. So then we'll move on to Chris Johnson for the community well-being and substance use education for School District 83, and I have a little bio for you, Chris. Mental health, Chris is the mental health coordinator for the school district. She has a long history working in the local communities in youth support programs. She will tell us about substance use related programs that the school district offers. Thank you, take the floor.
I actually predict the school district offers maybe more than we might guess. And so if the school district does offer quite a few things, you know, it used to be maybe 8 years ago, maybe 10 years ago, the policy was that if a student was caught with anything to do with marijuana or alcohol, they would be out for 2 weeks automatically. So a little while ago, a few years ago, they made this little program where instead of being suspended, they get to have a few conversations with me and not miss out a whole bunch of school time. And so a student might be suspended for 1 or 2 days, or they might just have to have some conversations with me. So it is a forced counseling service. It's meant to be about 3 times. And I wish I kept stats because I could tell you, I'm sure at least half of those kids like it and want me to come more. They love it when an adult is really curious about them and that they don't have to hide their stories about drugs and alcohol. So I hear a lot of stuff. I also do a little prevention program, which is for grade 7s and 8s to do some prevention work around healthy coping strategies and based on our personality types. We've got some other mental health programs in the school curriculums as well, and excellent counselors in all of our schools as well. So I think we probably do an okay job at offering something. And of course, there's lots more to do. I'm really hoping to use some of your education material in SD 83 as well. Another cool project that the school district has done is in Salmon Arm and here at ERS. We have a wellness center. So there is a nurse practitioner who's coming to this building twice a month to do medical care, and lots of mental health appointments fit into that. So we've been doing that in Salmon Arm for a few years, and we just reopened it here in Sycamoose. So this is a good student support program that I'm really excited about. And Jana Barra there is our coordinator in our schools for that cool wellness program. I do vaping presentations, and I've interjected a whole bunch of marijuana stuff into those. So hope I don't get in trouble. Does any, this, I always ask this.
More of those.
That's what I always say, hey, what's the difference between these 2 vapes? I bet you know, Some of you guys might have a guess on this. This is a dab pen, so this has marijuana, and this has regular nicotine vape juice. Actually, it's disposable, so it's probably a pod in here. But you know, they make marijuana products so discreet now. If somebody had a hit off of this, we wouldn't notice the smell. It's also covered up by these awesome flavors that our kids are being bribed with when they go buy vapes. And so I like to show this because I would say a student might not know what they're being handed. School staff might not know what kids are vaping out there or what they have in their bags. So I do like to bring that little trick along because people don't know that. And we're getting another program, we're a pilot project in the province to do some ICY programming, so I feel like we're getting, I'm guessing here, but it's around 4 net new counseling bodies to help in our district with these things as well, and that even includes a little bit of family support within that as well, so we're doing better and more all the time, more money is coming, because of course, we've had a really rough few years that pointed it out that we need to do a bit more prevention and support with our younger ages as well. And I think, yeah, I'll be around to answer questions later, but I do talk about marijuana. My other vaping thing is like a cigarette is a nicotine level of 8. Let's go with 8. This is really common and this is 20. I see 50 sometimes, I see 35 pretty often. In BC, we can't buy 50, but it's still around easily. People make it, they bring it from Alberta, they order it, they share it. Everybody shares these things. So there's very, very high nicotine in here compared to our cigarettes, even though our cigarettes have a lot more crazy chemicals in them as well. It's that nicotine factor that is an addiction component for a long time. I mean, that is your dopamine receptors that are getting messed with all the time with this vaping amount of nicotine in there. So I think our school district is doing a pretty good job and I love it. I love being able to talk to these kids anyway. I don't love that I have to have this job, but or that I have to go talk to grade 7s and 8s about this. But we are in the schools doing prevention as well. So that's all for me.
Hey, so that leaves us with Lyle Chapman, here, principal of the Eagle River Secondary School, our host tonight.
So yeah, I was just asked to come. I was given the very easy topic of what have I seen in schools? I think I had 5 minutes, so after I talk for 5 minutes, if you have 2 to 10 more hours, you can come by my office at some point. I've been in the system for 27 years now. I would say the shift in the last 5 is the most significant I've seen in schools. That's because of all sorts of factors that everybody's been talking about. COVID, legalization of marijuana, just the mental health concerns, etc. You know, one thing after the next, and it's really created a perfect storm of a system that I simply worked in and saw just trucking right along and not seeing a lot of difference in. And then the last 5 years, every meeting I go to with educators, they're like, holy cow, what is happening? What's changed? And it's not one thing, it's a whole bunch of things. So saying that, probably some of the most significant changes that I've seen is when legalization of marijuana and THC and products happened. We saw a huge shift in our schools, which we kind of knew was going to happen when they talked about it, and it was kind of in. I saw two big changes. One was access. So access to those products for young people changed overnight. Used to be pretty easy when I had a kid that I thought was high using a marijuana product, because I would just stick him in my office, close the door, go talk to somebody, walk back in 3 minutes later, and the smell of pot would make me fall over, and it was pretty easy to deal with. I knew there was edibles and et cetera out there, but the mainstream use and accessibility was not there. And the kids that we had that were regular users, they were smoking it. The difference now is that many of our kids that we know are using and we suspect are high, et cetera, there's no smell, I mean, they can take a hit off of these pens and I can walk around the corner 3 seconds later and there's nothing. The access to the gummies and the access to all that stuff just really was a game changer in what in what they have access to. So access was the first thing. The second thing is, we saw a big shift in the change in their mentality around the use of marijuana products and THC products. So it's legal. What's the problem? It's legal. That was a big immediate shift that we saw. In students, they really do not see it as serious of an issue anymore. Regardless of the fact that all the way through, we talked to them about brain research and et cetera, and the damage and the prevention, et cetera. But what do you mean? It's legal. So those are kind of the access and the attitude were the two main changes. And that all happened along with, the other major shifts in the world all at the same time. So I've been blessed so far to not have to use an naloxone kit, to not have a student OD. Yeah, I thank whoever you believe in, that I haven't had to so far. I was lucky enough to be in another school district that was also very proactive, and I've had naloxone training for a number of years because they said, well, it's like you're gonna deal with it one day. We just went through the training with our entire staff at the school in the last couple of weeks, and our staff was very open to knowing about it. So I could go on, but that's there's been a shift. Educators, educational leaders, the ministry, they're all aware of the shift. They're all aware of the changes. And the changes are not just the big hit drugs that everybody's hugely concerned about, right? The heroines and all that. It's the regular everyday, alcohol, THC, all of that, the access to that and the use and the just we're okay with that attitude is, yeah, it's been a big shift. The vaping, talking about vaping products, I calculated with a student about 3 years ago who I saw in a year, a healthy young adult athlete who was 170 pounds. He lost about 25 pounds in about 7 months, and we figured out that he was probably inhaling the equivalent of 7 to 12 packs of cigarettes a day because of bubblegum, watermelon, blueberry, tastes great. So there's lots of that stuff out there. It's happening in our bathrooms, it's happening in our halls, it's happening everywhere. End of the day, I had a CEA bring me a present that, a pen dropped out of a kid's bag, and it was sitting between two of them, and the adult was like, oh, and both of them like, come on. So it's mine now. My office. So yeah, I'm happy to have any conversations you want after that, but that's kind of where to stop.
No, I can add to that too as well, because kids feel like they don't have to hide the fact that their parents give it to them or smoke with them now because it's legal. And so that's really been a big change too. Kids don't feel like they're ratting on their parents when they tell me where they got it. So maybe that's progress in our conversations, or probably not.
Well, I mean, 6, 7 years ago, if I called the family and said, hey, I caught your kid smoking or he's high at school, their question, well, where would he get it? And I would say 1 out of every 3 conversations I get, well, that's probably mine, or, well, no, we just smoke it together at night. You're not allowed to bring it to school.
Exactly.
Like easy 1 out of 3 conversations are like that. And those are the ones that are honest with. Huge shit.
Well, I think that ties back to social norms as well, like Jeff was speaking to, right?
Huge shit.
No one bats an eye about, going and grabbing a beer after work with your coworkers. That's fine, but it's what those social norms are saying is okay, and confusing that just because something's legal doesn't mean it's always safe. And just because something's illegal doesn't mean that it's necessarily unsafe either, right? So like it's all about that continuum.
As you're saying that, I was thinking about, you got the vapes,
you got this damn thing. And then you got cannabis or other things too. Oh, and then energy drinks. So I get a good Red Bull, I get a good vape, and if I'm on my phone, holy poop.
Three addictions at once.
Oh, just let's go. And I haven't got out of bed. Honestly, one of the things you see with vapes compared to tobacco is most people would smoke half hour after they go to bed. Most kids, I'll ask my kids because they vape and other people, you pick up your phone first or your vape. It's a vape. Sometimes either way, it doesn't matter. You're not out of bed. Anyway,
Energy drinks, the 12-year-olds that walk into my building every day and consume 2 to 5 of them a day. Every day.
Risk management.
Okay, we need to, we're done. We're done now. Okay, thank you. All right. To, I'm sure you're gonna get more questions later. Okay, and now I am turning to Lori Weber. Lori is on Zoom here, waving at us, and Lori is a recovering addict, and she is an incredible lady who's going to share some of what that has meant to her over her life and how she's living in recovery now. Thank you, Lori. You can go ahead.
Hi, can you hear me there?
Yes. Lovely.
Awesome. I'm Lori, and I'm a grateful addict. And I'm grateful because there was help. There were beds available. There were people answering the phones. There was no such thing as harm reduction when I was using. And I don't think that if there was harm reduction when I was using, that I'd be sober today. My experience, and mine alone, is that abstinence works. Abstinence is the key to sobriety. I'm not saying we don't need medical detox. We do. The drugs are stronger. Whether they're toxic or more deadly, that's for our professionals to figure out. I'm not a professional. I am an average person who had a drug habit, who had an alcohol problem. I wasn't alone. And I fear for our youth today. We're taking away consequences. It's 4 a.m. in Vienna. So my apologies if I'm kind of all over the place here. I do have some notes. By taking away consequences, we're not helping. I had a healthy fear when I was using. And a healthy fear in an unhealthy lifestyle is necessary. I was afraid of losing my husband, losing my home, losing my child, getting arrested, thrown in jail, you name it. It scared me straight. It scared me right into a treatment center. Was it easy? No. It's never easy, and you're never alone when you're in a treatment facility. And I see the harm reduction, and I applaud people like yourselves here tonight, this morning, whatever. Sorry, that are doing the best you can with what you have, because that's all we can do. I used to speak in schools. I used to talk to youth. We don't get asked that very much anymore. And I do think that experience helps. I think somebody who's been there, done that, can teach easier than somebody who may not have that experience. I was addicted to cocaine and alcohol. I do not drink, and cocaine, I honestly haven't been around it in many, many years. We need to bring back some form of consequence for people. We can't just force treatment. Forced treatment They might get a little bit of the message, but they're not going to get the whole thing. We need the tools in everybody's hands to help. We've got a great start here, but we're losing way too many people. Way too many people. Drugs aren't more toxic or more deadly than when I was using. They're just more abundant, is what I see. That's my experience in it. It's normalized, and COVID helped that. We normalized wine Wednesdays for moms. We normalized use for people. You're having a hard day, you know, go smoke a joint. Pardon my language. Smoke a joint. You know, go. Stress relief is a huge one. We have dual addictions. We have dual diagnosis. We have so many problems surrounding it that it's hard to get to the core. And the core of the problem is pain, is trauma, is always something. We don't have enough beds. We don't have enough government funded beds. When treatment's $16,000 a month, I don't have that. How does anybody else? Giving a safe supply, is it helping? Are safe injection sites helping? Are the harm reduction methods helping? When it comes to a safe supply, they're selling it and getting the fentanyl because tolerance is real. They want the harder drug. They built the tolerance to the harder drugs. I know this. I know. I did it. I could talk for 4 hours. Unfortunately, sleep is coming fast. We need to be able to say yes in the moment. We need to be able to say, yes, I'm going to help you. Yes, there's a bed available. We need accessible treatment in a meaningful way. We're handing them a loaded gun by giving them all these harm reduction methods. We're saying, here, we've normalized this. We've normalized marijuana. We've normalized alcohol. We're taking the stigma away from drug use. Without a consequence, nobody needs help. We just don't. And I honestly don't know what to say to that. I wish there were treatment facilities. The government can find ways to help the homeless. Let's put those, oh, they turned on the lights. Let's put these, take the homeless that are addicts, turn them into a treatment facility. Give them a good 6 months of recovery and get them to come back and help. I don't know. I don't know. I don't have the answer. I just see people living in the problem. Too many kids are dying. Too many people are dying. And I'll be around for questions for a little while. I've been up since 3, so I'm not sure that I've even made any sense here. But we need some real consequences for these people. We just keep lowering the bottom for them. And the lower the bottom, the lower they'll go. We can't save everyone, but let's at least try. And that's going to be my portion for your night, my morning. Mm.
Thank you for your honesty. Hope you can stay awake for a bit. We are through the speaker presenter portion. It is time then for everyone else's chance. If you've got questions in the gallery, if you've recorded any questions for specific presenters so that you can do that, then just raise your hand if you'd like to speak a question to the panel
Or comments.
or make
Right.
comments.
Yeah. Open dialogue.
Oh,
Elbow grade out of the way.
yes. we're honored to have the Greg Kylo, our MLIA here, and I was gonna give you the floor to close the whole thing down, but
Oh.
go ahead.
I can wait till the end, if that was your preference.
That, no, you got something to say, go ahead and do it now. I just wanted to let you know that I planned
A
it.
little bit closer to the speaker.
Yeah, you better.
Anyhow, I wanted to first of all say thank you very much to Siobhan and the District of St. Louis for providing the platform, and for all of you for the presentation. I certainly learned a lot tonight. So I want to thank you very much for your time to share with all of us and for your honesty. My name is Greg Kylo. I'm the MLA for Shuswap. I've been the MLA since 2013, so just had my 10th anniversary here a couple of weeks ago. So it's certainly my privilege and honor to represent the hardworking men and women here at Shuswap. I'm a former graduate of Eagle River, 1986. Got 4 daughters, 12 grandkids. As all of you or any of you that have been a parent, you know what it's like dealing with young kids going through puberty and friendships, and you know, as they start to experiment with alcohol or maybe even marijuana, back then with my kids anyhow. But it's such a different state of affairs we live in today. I got 12 grandkids and I'm really fearful. There was conversations Laura shared about normalizing otherwise very dangerous behavior. What do kids hear today? They hear safe supply. Drugs, addictive drugs that can kill you are not safe. You know, you can't not even buy a pack of cigarettes without a dead person staring at you. And yet what do kids largely hear about drugs? It's safe supply. We see governments moving with decriminalization. And Murray, I really think, and it was important for you to be able to share that, you know, for at least the last 10 years, police and the courts really haven't been pursuing charges for these small amounts, but the perception is really important. Lyle, you mentioned about how the change with the legalization of marijuana, it changed people's perceptions. It's normalized. Otherwise, what was a behavior that nobody would be putting their hand up saying, oh yeah, I smoked drugs with my parents at home. 10 years ago, that would have never happened. So it has changed the behavior. And that's, I think, the concern that we all have. So we see, I know, government moving forward with decriminalization. It's the perception that kids are going to build from that. You know, who here has known somebody directly or lost somebody from a drug overdose death, right? It's hit a ton of us. It's, you know, our friends, our neighbors, our family, you know, daughters, uncles, aunts. So it's hit a ton of us, and there's got to be a better way. And Lori, your comments were really heartfelt. We need to get people on a path to sobriety, you know, and getting them off of drugs. Allowing people to have access to publicly funded drugs, it might be a great step. And I'm not saying that the decrim doesn't have a role, but it's not the solution. We can't have society with people being provided housing and free drugs for the next 30, 40, 50 years, not being contributing members of society. There's got to be a better way. And, you know, those that are addicted to drugs, at some point they crash. And when they need help, that help needs to be available right then and there. You wouldn't show up at the emergency room with a busted femur and the medical staff saying, we'll have a bed for you in 6 or 9 months. That just doesn't work. But that's exactly the approach that governments and all governments have taken for a very long time. There's been no immediacy of treatment. The treatment beds need to be available when they're ready. And that's, you know, a focus that I think needs to be taken by many governments. We see this path with the decriminalization. It's a failed experiment on its own. We saw what happened in Oregon when they brought in decriminalization, a 39% increase in overdose deaths in the first year. The federal government put very strict restrictions in place. So in order to support BC moving forward with this experiment that we're on right now, there was very strict requirements. They had to do all the baseline establishment of all the data. How many treatment beds are available? What's the state of play in BC? That way, when you make a change, they'll have at least an ability to determine what's working and what isn't working. That work was never done. It is still not done. And the other piece that was really important is that the federal government said that treatment beds need to be available when they are requested. That is not happening. Beds are not available. Despite government having $2.71 billion in surplus that was all spent the last month of March, The amount of money that was set aside for drug rehabilitation does not in any way, shape or form match the severity of the challenge that we have before us. So, thank you guys very much. I certainly don't have all the answers. I want to continue to learn a little bit more. But I really applaud you, Siobhan, for taking the time and putting this together. And Pam and Janet and
Yeah,
all the those who are involved.
Quite a
But,
crew here.
but anyhow, thank you very much. And,
Yeah.
and I'm always available to be better educated if there's something that I'm missing or if there's anything that you guys want to share.
We got lots of evidence if you ever want it.
Yeah.
Thanks, Ray. Thank you. So
I gotta stay here.
you have it.
I
Okay.
do. I'm Siobhan, Rich, I am a resident of St. Louis, I grew up here, I graduated also
Yeah.
from school.
Alumni.
Lived out in White Rock for 20 years and I moved my family back, I have a 12-year-old and an 18-year-old. So I'm a mom first, and honestly, decriminalization has scared me. The whole thing that has happened. And that is how Pam and I kind of got involved in this and started putting things together with the community. Because I really believe education is key. Something that has happened to me personally, one of my best friends lost her beautiful daughter who OD'd 23 days ago. It's been 31 days since I hugged Carly, and Carly was here. She was a beautiful, hardworking, smart, wonderful person who did not die alone, who had a habit and she was waiting for a bed and there weren't beds available for Carly. And she waited 31 days and she died because of it. But Carly and I had a conversation 31 days ago when I hugged her. And I said, because we were really open and she was a firecracker. People say, oh, she'd light the room up and she'd light it with a torch. She did not ray of sunshine. It was like bang, full on. And one of the things I talked to Carly about because of my fears, because I have young children, was, what is this going to, what do you need, or how do we stop this age, the 12 and 18s and into getting, like, becoming dead? And Carly didn't believe in a safe supply. She told me straight out that I go to the vending machine and I put my money in, she was on the coast, and that she would sell those drugs to buy drugs that would help her get the high she needed. And those drugs were sold to, there was someone actually bought them, like stood by the vending machine, bought the drugs, and then sold them to this age. They're just starting out. And this age goes, oh, well, that's the safe supply. So, they feel more comfortable taking it because they've got the fear of God in them, but it kind of, so I guess my question is, how do we stop the youth, like the 12s to the 18-year-old or the 11-year-olds, from thinking that a safer supply is safe? Because I can preach as much as I want, but when they're with their friends and there's peer pressure and you've had some beer, all those kind of things that happen at parties, how do you get them to stop that? So if anybody has, and I know not like I would.
I think it's a great question. Like, honestly, I think if we had the answer, we would do it. The trick is, I think it's complex. And I think one of the other challenges with drug problems is they're rarely about drugs. Or how we try to solve other problems. And you're right, some of the wording is challenging, I think, around safe supply. And when we need to look at some of that stuff for sure. And of course, we worry about diversion. We're seeing a very small percentage of it, but any diversion is bad. Again, I come from looking, I'll show you this thing. There's a thing at the back you can see around the paradox of prevention, looking at drug policies as a whole. As you mentioned, alcohol, right? I've done drug and alcohol stuff in schools for a long time. Kids would get spent for smoking weed, but they have alcohol with their parents, and that'd be okay. Well, they can't handle their alcohol. Who says that they can't handle their fentanyl? Like, we have some really culturally things around substance use. And I think some of it as well is when you look at young people today, the evidence is looking at, they're drinking less, they're smoking more weed, but they're drinking less because they know it's safer. So I think there is a lot of good stuff happening. There is still a lot of damages and still a lot of things that need to be done. But I think part of it is that openness. How do we get there? The bed supply is an issue in this province. And anywhere, we can't tell you exactly what works for drug treatment. We can't tell you how it actually plays out. Is 28 days good? That's only based on insurance programs. Right? A lot of our stuff is very moralistic. It's not about evidence. And so there's these lot of things, and I have no problem. If abstinence works, that's great. You won't get pregnant, you don't have sex. Pretty good evidence on that. You can't have drug problem, you don't use drugs. The problem is sex is kind of fun. And so are some drugs. And there's a difficult line there. And so for me, part of it is there's no black and white, but it's this continuum. Yeah, please.
One thing that I think about when I think about this, is I went to this,
Go and get that.
and then I went to Seminar Secondary for
Yeah.
years, and now I'm at the University of Calgary.
Yeah.
And almost all of my friends that I know that have used drugs or that started using drugs, it usually wasn't just for fun. Usually kids had stuff going on at home, usually kids had mental health issues, and the mental health support or lack thereof in our schools, and I know we're trying, but access to good therapy and good counseling and treatment before we need a treatment bed,
Yeah,
like treatment when you're in grade 9 and you're having at-home problems and there's no support. And I mean, there's a little bit of support and there's a little bit at Seminar Secondary, and even at university now, the mental health support is so limited. And it's so much easier to go smoke weed at your friend's house, which leads to other things, you know what I mean? And so
Or
targeting
drink.
the issue before we have to target treatment beds, maybe we can target treatment of mental health, right? Yeah.
I agree. I think, and even to go a step beyond that, for every dollar you put in prevention, you save 7. So if you don't care about the people, you're saving money. And we don't even really talk about prevention, but making sure kids have a safe place to live, have enough food in their stomach when they come to school, that they're not being hurt in places. And so
Practice program and having good counseling and having
Yeah.
kids come to school and
safe
feel
communities.
safe and somebody they can talk to before
Yeah.
we have to give them
Absolutely.
safe supply because they're already using, you know what I mean?
Exactly. And so that's why we're talking, like the stuff we're talking about, and quite frankly, the medical system, prevention is 3% of the budget. 1%. Okay, so I was really over. So we don't even get there. And that's why we like coming to places like this. Is because communities and other places have as much influence, far more influence, than our healthcare system does. People want our healthcare system to fix you when you're broken.
Or we try.
We try.
Health nurses.
Right, yeah. Right, but large part of our system is based on, like right now, there's a big thing in Kamloops about a cancer clinic. That's important. How come we don't have warning labels on alcohol, as you talked about? There's warning labels on tobacco. How come alcohol doesn't have it? It's a class 1 carcinogen. I work with a lot of people who talk about drugs, and I'll say, so, you know, I use a lot of cocaine. Okay, do you ever use cocaine before you drink? No. Okay, so the problem with cocaine or is it alcohol? And so I think, again, it's very nuanced. I like to say there's a simple answer
You can buy we have safe supply
of
of
alcohol,
drugs. We have it called liquor stores. Yeah.
and we have safe
Right?
consumption centers, just
100%.
add one, Moose Mulligans.
Right?
Right, let's call it what it is. Let's call it what it is. Let's not get moralistic.
Exactly.
Honestly, part of the real challenge is, I don't want to open this can of worms, I'm going to, is our drug policies are based on race and class. They're intended to hurt colored people and poor people. That's the whole reason they're invented. They weren't invented because of damage. 1907 laws take 101 drug policy. That's what it's meant to do, and it's still doing that. It's working as it's intended. Poor colored folks. That's why alcohol's okay, because it was a white thing. Opium was about the Asians and the Asian riots, and white guys went and kicked the shit out of them because they didn't like they were working so long. So there's some real inconvenient truths about our drug policy. That until we get over, people are going to continue dying. Because we're going to keep splitting it. That's about this or that. And until we do that and call the evidence on it, people are going to die.
And I just, yeah, and speak to that too, I think both of you you kind of nailed the
Yeah.
answer right there. The first thing is when you're scared, what do?
Yeah.
Educate yourself. But are you educating yourself from the right place? Like when we speak to most youth, you know, where are they getting their information? They're getting it from Reddit. And this is for substance use and for sexual health. It should be coming from an evidence-based place where we can have realistic, open conversations to teach people about those risks. And like you said as well, like that is huge. It's not the substance the person is using, it's why are they using it? And there's a lot of reasons behind that. So programs like Chris does with Preventure, where you're teaching youth resiliency skills to be able to adapt those not only to substance use, but to all aspects of life. I think the more that we can educate, the stronger our youth are, right? And I also wanted to thank Lori too. I think that is huge as well, is remembering the importance of peers and people with that lived experience. They have so much to say because, like she said, you know, she walks the walk and she understands. And it's being able, like she was saying as well, like provide those low barrier accesses that person needs at that time. And so if that's abstinence, you throw everything into abstinence. If they're not quite there yet, you throw everything into there to get them to a point that you can help them. So yeah, I think, like you said, educate, but make sure it's from the right place.
I want to read you two things that are in the chat.
Janet.
Sorry. So the first is from Michelle. Many of my clients are on waiting lists for treatment. They're desperately trying to stay sober. In the meantime, it's hard when they have struggles or are homeless. The next is from Carly's mom, who's online. Sorry, it says, my Carly tried so hard to get into a program. She called daily and was told every day, just a couple more days. After 31 days, she ran out of a couple more days.
And that's absolutely tragic. And that's a system failure. Let's be honest, right? It is.
And sorry, what's her name? What's Carly's mom's name? Allie. Allie, thank you so much. Like as a mom, of course, you're gonna make the pregnant lady cry, but it's scary. You know, like I work in this field and, you know, it terrifies me as well. And when you see the number of hands that went up in this room for people that have been affected by this, that is just heartbreaking. And that's not okay. And is it a complex issue? And do we have the answers? No. But I think between all of us, there's a lot of, like I said, even though we may all come from different perspectives or different backgrounds, we're all here for the same reason.
Yeah.
And I think all of us have a lot to add for how we can change that. So yeah, I'm so sorry that that's happened to everyone. And I just, yeah, thank you so much for sharing.
I think Lori's wanting to
Oh, okay, go ahead, Lori.
have a comment on her Zoom.
Lori?
Go ahead, Lori. I think she's muted.
Hi, me again. I'm hearing some really good things coming out of everybody tonight. I really just wanted to touch on the 31 days that young lady spent waiting for treatment bed. That's 31 days that she could have had a head start in her sobriety, but without the supports surrounding her in that moment, she didn't get it. Every day, someone's father, mother, sister, brother, son, daughter, grandchild, dead. Dead because we as a society have normalized use. We have normalized alcohol. We've normalized marijuana. We have a safe supply that isn't safe, and they're dying. We need options and we need treatment available. We have a fleeting moment when an addict has that moment of clarity that says, yeah, I get it. I want this, but you got to wait 6 months. Again, everybody has said wonderful things. I don't personally have the answers, but I sure want to try and find them. Thank you, Allie, for your bravery tonight as well. It's not easy. That's it.
Lori.
Yeah, and these are not fun conversations. I always like to think in health, we talk about healthy babies and depression and that's recidivist. That's not it, unfortunately. As police don't have every knock on the doors at night saying, I got your kid home safe. Or teachers, other people say things are looking good here. And as community members as well, seeing friends, family, colleagues, right? Slowly suffering from a magnitude. And then let's be clear, our culture does love drugs. All the drugs we have, pharmacies, we have drive-through pharmacies. We have drive-through drugstores.
Yeah.
Right? We love drugs in our community. And this is part of the problem with it around legalizations versus illegal. It's a real challenge, right? But anyway, you had a question. Or comment?
I'm Brent, I'm the school board trustee for this area.
Yeah. We trust you.
Yeah, this is my first term, totally out of my wheelhouse, but I'm here for the kids, and I mean, this is for all ages, but the reason I got into this was for the kids. Every single one of you brought up amazing points. Chris, I didn't even know you were here, and I don't even know who you are, but.
In no time.
Your first term, just wait.
Yeah, we'll see how it goes. So many platforms to talk on. When you guys talk about opioids, does fentanyl fall under opioids? Yes. When the government realized that this is a taxable issue and there's a storefront for this stuff on every corner. The same problem that Lyle saw with the marijuana, he's gonna see with the other things. That's what's scary for me and my kids. I have two girls that are 10 and 12 years old. And 25 years ago, yeah, all we heard about was how bad every one of these drugs are. And now they're normalizing everything. You brought up an amazing point. These things are just as harmful as any drug we talked about today. Social media, I listened in on the school district sessions on the harms of social media and the sexploitation. It's terrifying. But what terrified me more is that we have a school district with almost 7,000 kids, and there was 18 people on that seminar. 18, that's it. And it's the same people that are here, we're here to compare. You go to PAC meetings, there's 7 or 8 people there. Those are the only 7 or 8 people that, everyone else is afraid that they don't want to come out for whatever reason, but it's tough. We can all talk as a group, but we're the group that is caring. We need to plant the seeds outside of this room and spread all the knowledge that everybody here has contributed. Lori, I appreciate your bluntness and being out there, because without difficult conversations, you will never come to conclusions. You need to ask difficult questions. You need to pose difficult situations so people understand. And if it doesn't affect people, they usually don't care about it. They just stick their heads in the sand and they walk away and they think that it's just gets normalized. So I just want to thank every single one of you guys up here and everyone that showed up today. Yeah, I hope that my next few years in the school board, I hope that we can really make some positive steps forward. It's totally different than the role that I thought it was going to be.
Read the job description. Well, it's not like other, there's a bunch of other.
Yes, I come from a background of, I'm a mechanic by trade. I work oil and gas, so it is very much out of my wheelhouse. My communication skills are being honed. How I use my verbiage and many other.
They're different cultures.
Very different, but we can still work together. So.
And actually, I agree. Thank you very much for saying that. I think part of it is, and I really like having diverse conversations. I think one of the things that's been really lost in some of this is the ability for us to have diverse discussions about our differences in a good way. That we can have differences and it's all right. And how do we come to a conclusion? That's kind of what community is about. Without trying to score points for one side or the other, win. Right? To me, if conflict's about winning, we both lose. It's about better understanding. So how do we do that? And it's not easy, but we need to.
I'm just wondering if we could unpack a little bit with your knowledge, the abstinence piece, because I agree, like, we could reach abstinence about sex or about crossing the street or jaywalking or anything, right? And so some people aren't going to be able to enjoy alcohol or other drugs. In a way that doesn't have them live in fear of dying, in fear of losing their job or their house or their family and their relationships. So for me, and I'm not saying I don't have my own struggles with alcohol. I've raised 4 teenagers, one with autism, and let me tell you, I've never drank so much in my life as the time.
Oh, you were out. Brain injuries are forever. Speaking about prevention.
Right? You guys should listen to the abstinence piece, huh? Of the pregnancy abstinence piece, anyway. But the point is that, you know, you don't cut off your arm to, you know what I mean? So I think this is a bigger conversation, and I feel for people who have lost loved ones, and I don't think, as you've mentioned, Jeff, there's all these issues are so complex, so multi-layered. I don't think there is a right answer. Yes, we need more treatment beds. Yes, we need more coaches to do soccer games, so more kids are involved and engaged, and 4-H leaders, and you know, it's all that as well. It's not just about how many beds we have or how much more naloxone can I train for and train about and pass out, and it need compassion. We need kindness to each other and not as much judgment as well.
And I think
I was gonna say, I heard this great quote the other day. I was actually at the Healthy School Promoters for each district, and their mantra was compassion, not comprehension. We don't always have to understand why, but we need to have the compassion piece. So if you're compassionate at whatever place that person is at, and yes, like, it is so complex, like, and that's why I think it's so important to think of substance use within a health issue, because you need to be able to address where that person is at and have the available supports for where they're at and immediately have those supports. Yeah.
And I think we've done a poor job in the healthcare system up to now. You know, we would treat someone who comes in with a cardiac issue very much differently than someone who comes in with a substance use disorder. So I think that we are changing. I think it's happening right now. I see it in my work that it's being looked at differently. There's things happening in the health authority to look at the issues and try and move in, you know, a positive direction and look at people, you know, reduce the stigma so that people feel comfortable even talking about their substance use disorder. Or their substance use, maybe that's not a disorder, but just talking about substance use, right? Well, so, yeah, sorry. Yeah, so I think it is changing, and I think we are moving in the right direction. But it's not fast enough. And unfortunately, the drug supply has changed. It is more toxic. We see things that are affecting people and causing them to die that we didn't see in the years previously.
And some of that's based on policies of stopping other drugs coming in, like
Yeah.
heroin, that's
Yeah.
harder to get in, where fentanyl is easier. If we had a heroin, we'd have less overdose, but anyway.
That
Go.
like
Just listening to everyone kind of speak tonight really reminded me that when we're seeing substance use issues, that's not usually the drugs that are really the issue. It's like what's going on underneath that everyone's trying to manage. And we've been through like 3 years of trauma, like most of us, like maybe you weathered COVID just great, but I think.
There's some real introverts that loved it.
Yeah, so. So, but there's a lot of people who like. It was a really difficult time, one way or another, our kids, definitely, I know I've been looking for mental health support for my daughter. Incredibly hard to find.
Yes,
Right?
it is.
It's like, and I'm lucky enough I have health insurance, but I've blown through that, and now I'm looking at $105 every session. And I know I'm lucky, I can probably make that work. Most people. You're at.
Yeah. And that's if you find a person that works for that
That's,
person.
yes.
If you only have a couple, they don't work.
Yeah, and even just finding someone who will speak to a child, really difficult in person, speak to a child. So I think when we're looking at these bigger pictures, you know, problems, and we're wanting to prevent them, maybe this isn't the quickest path, but it's a path we need to look at. We need beds, yes, but we also need prevention
And coping.
and coping strategies and.
And healthy
supports.
lifestyle and
Yeah.
food and housing and like.
And not
And
waiting
also-
9 months for a counselor.
Yeah,
you
as
know?
you mentioned, right, there's this kind of thing around, like absence is part of harm reduction,
Yeah.
not different. They're part of the same continuum.
Yeah.
Right, but we seem to kind of.
Yeah.
Do this, and so there is a lot of stuff that needs to be done that's very diverse, and the problem, quite frankly, is prevention takes a while. It doesn't really fit into, nothing against the 4-year cycles that you're on, that's part of it, right? It doesn't fit in that, it's gonna be 15 years, 10 years of good food, housing, what we call investment in people.
Yeah, so I guess,
But
when-
what's that look like? I don't know.
I guess we're thinking as a community, gonna deal with it. Forget the underlying, because in 10 years, what we're doing now is what we're giving.
And I have to say, like, I work with a lot of different school districts. And I'm not just saying that because I'm here, but school is phenomenal. No, it's never enough. There's always more, but like the work on prevention, the work on, alternative intervention. Yeah, a lot of that where you look at youth that have trauma and maybe school is the only safe place for them, but to send them home. Not always the answer. And obviously that's a very blanket statement, but I think there's some amazing work being done here within this school district that really needs to be applauded.
And what's working here doesn't necessarily work in other communities.
Yeah.
Or, well, stuff's urban centric, right, comes from Victoria, Vancouver, it doesn't work with shades up here. And so we have to tailor that too. So that's messy.
It's all messy, but it's all good.
But it's good. This
Right?
conversation
That's why we're
is
Yes.
good. Yeah.
Lori wanted to say something.
Yeah, Lori and
I am going to say good morning from Vienna and and just say, if I was still in active addiction, I wouldn't be sitting in this restaurant in Vienna,
People.
right? If your life is stressing you to the point where you think you need a glass of wine because the baby's giving you a bad day, pick up a phone and phone a friend instead of picking up wine. Pick up anything that's going to keep you in the moment, because the moment, those are fleeting. And let's just enjoy and let's continue the conversation. I would love to meet with all of you when I get home in a week after about 3 days of sleep. And let's keep the conversations going. There's a lot of good things being said, a lot. And there's no right or wrong answers. It's just, let's get people help and support.
Yeah.
Good night.
And I think I saw a hand up.
Yeah, I think there's.
I'm just going to comment, I'm of the older generation, so a lot of this drug stuff, I don't know about it. My daughter is 23, she happened to have some friends over and they were talking about stuff that happens, school, community, whatever. And so I was just sort of listening and seeing what I could glean from their experiences of drug supply. I mean, of ketamine and ecstasy and cocaine, and apparently you do all that together and you.
Sure, want to recommend it.
Like,
People have sex and drive too, I wouldn't recommend that either.
and so you're just kind of going, I don't know enough about this type of stuff that these kids know so much about. And in order to help, you have to be informed. And I think that's where we all have to be able to learn a lot and try to figure out how we can best help.
Yeah, and make sure that your evidence is correct, right? Like
That's right.
there's so much research out there, and I think a lot of what, social media may portray or
Andrew Tate.
or the news, it's not necessarily the truth, right? So it's all about
Sorry.
finding that correct information. Yeah.
And for the kids that aren't using, they're scared of the ones that are, because what if I walk into them and I find them overdosed, or I find that they're using and that they're not making safe decisions, they're driving, whatever, and it's a real, I think it's really hard.
But it's a great one. For example, they're probably all familiar with alcohol,
Mhm.
which is one of the most dangerous drugs we have.
Yeah, yeah.
And before there was safe supply, a lot of people were dying.
Yeah.
And so it's one where you can talk about how that plays out, what's the effects? Why do you like it? Right, if I'm gonna dance with you, a couple beers will help me ask you, I'll be no better of a dancer. And you're less likely to say yes, but like, what are the reasons? What do we go for, right? You talk about supply reduction. What about demand reduction, right? Those pieces.
Okay, Donna, did you?
Oh.
I've heard the word trauma a lot,
Yeah.
and I want to introduce the group to a gentleman named Greg Nickel. I'm throwing it under the bus here.
Or you gonna let him drive a bus?
I think I would just like to have about 5 minutes of his time so you could hear what his program is. So he can help communities, people, groups of people like nurses go through trauma. So he's down to 5 minutes.
Yes,
A
great.
little bit.
Right here. So yeah, my name is Greg. I work for the mobile response team. We provide free psychosocial support for frontline workers, first responders, peers, people with lived experience. So we do one-on-one supports, group supports, critical incident debriefings. We support communities after major incidents like a suicide or a major overdose within the community. We work within the overdose mandate, COVID-19 mandate, and then a greater disaster psychosocial team. So we respond to fires and floods as well. So our team is here to support people who work on the front line, people who are within a community who may have gone through a disaster or trauma. So we do, like I said, one-on-one support, so individuals can reach out to me and we can over text, over phone, over Zoom, over email. We can meet in person as well. We do group supports. We have workshops on stress, injury, grief and loss, boundaries, things like that. We're really trying to keep people healthy in this field. As we know, the past couple of years have been extremely hard. My background is I live in Kamloops, so I worked in the shelter for almost 4 years. I worked in a supervised consumption site. I was a bylaw officer and I work for Ask Wellness as well, which is a nonprofit in supportive housing. So everybody on our team has frontline experience in understanding the work that people in this room may be doing or know people who have. Like I said, the past couple of years with COVID, we've really seen that domino effect of just the poison drug supply and the impact that is having on people who are working on this field. And our job is to come in and try to just filter some of this heaviness that people have had or maybe dealing with. Like I said, we do critical incident debriefings as well. So if there's a fatality or an aggressive incident, we can come in person and do a debrief. And yeah, like Donna said, I think, sometimes, we're looking at people who use substances, but I know from my own experience, I think, and the vast majority of the first problem is trauma. And I know we say, we gotta take care of each other as a community, but unfortunately, and especially after COVID, we see more people who are individuals within the system, right? And that's why, coming together in a group like this is very important because it does lay the foundation and the seeds for the future. As we are, as we are talking about cell phones, right? I know I'm 28 years old, so my generation, right? We would, we're gonna DM, we're gonna text, but we're not actually gonna go hang out, right? We're not actually gonna talk about what's going on, how things have been. So, it's really about coming together not only as a community, but like someone said too, like that compassion, self-compassion with each other, right? We know life is hard, the cost of living, COVID, drugs, right? We have all these compounding factors that people are dealing with. So it's really just like checking in with each other, checking in with your neighbors and coming together like this as a community. This is my first time being out here in Sicamous and, I can feel, the community. I grew up in Williams Lake, so I was born in St. Louis, I was adopted, I was in foster care. So I understand, the trauma, the impact that trauma may have, and it may push people to relying on substances or using substances as a way to escape. So my job is to, like I said, we're just here to filter some of that heaviness. Obviously, we can't come in and change systematic issues. We can't do that. But what we can do is come in and just give people a space to unload some of that heaviness that they may have felt or may be dealing with. So if there's any questions I can answer since I understand.
Where's your card?
I have a bunch of cards.
All right, that's what I want. No, it's
Janet?
it's definitely.
I'm just, I want to read another. Carly, mother has posted it again in the chat. She says Carly was an amazing athlete and the majority of her life, she played competitive baseball and soccer. She had a white picket fence childhood. please understand, this isn't generally due to lifestyle and social status. Look at mental illness and trauma as discussed earlier. And I would like to say, as I near retirement after 25 years in a field where the support society, our only goal was to help people with whatever it was that came in the door. Literally whatever came in the door is what we intended to help with. And our youngest person here gave to me the very best piece of advice we've heard, and that is, from the time we see a mom with is pregnant, from that time, those supports need to be in place all along the way. We need to accept that we don't always understand why the trauma happens, where it comes from. They don't always understand why the trauma happens, why they feel the way they do about things. We see people at the very beginning of a schizophrenic journey, and they have no idea what's happening, where they're going, why that's happening. We do have to put supports in everywhere along the way. I think we would see an enormous amount of prevention. And even in our community, we have a community of addicts. They are mostly not young. That community does support each other. They do try to help each other. They do access food security programs. They access advice from us. They bring their taxes every year so they can keep benefits, income assistance benefits. So I think it is that Sicklewoods is a very, very fortunate community in that regard. There is a very holistic way already in this community of how we support people. And I think the conversations are long and many yet, but I mean, I do feel like as a community, we are already trying our best to support people.
My name is Colleen. I'm both a parent to two students at this school. Both who have mental health challenges and one who has autistic. I'm also a member of a perinatal field, so I work in perinatal substance use and have many hats, but I just wanted to speak to the fact that everyone's journey is different and their path to safety is going to look different for everybody. So all of these pieces are important, and I think most people here know that, but you know, the decriminalization piece is an important one too. It has its place in bringing safety to some members, because some people will never seek help without having the safety of knowing they're not going to get arrested. You know, harm reduction is massive because it gives people the opportunity to use safely before they're ready. And you know, their abstinence is massive too. All these pieces are huge. Speaking to the pregnancy starting at the beginning, you know, I see a lot of people in substance use through the journey of perinatal period. And I think it's really important that the compassion piece comes first, that person will never be able to access help without feeling safe enough to say, I need help, feeling safe enough to say, you know, there's stuff in my past, having that mental health piece. So all of it is connected, that having that compassion is key. You won't get support or help if you don't have people who are safe to talk to. That's number one.
Absolutely.
Thank you.
Thank
you, Colleen. Is there anybody else that would like to ask a question or make a statement before I believe we've probably run over.
You're gonna look at that cell phone? Don't look at the cell phone.
Don't look at.
She can't see the clock.
I just want,
I'm not sure
I would
I
like,
can read it.
I would like to thank you all, this is incredible, the contribution that's come from our panel, but also the contribution that's come from the gallery. It's been, I think this is the kind of thing we all feel overwhelmed, I think, by the size of this, but I only see a way through it if we come together like this and we problem solve as a group with all of our experiences and all of our expertise. So thank you to all of you for being here and being willing to come tonight. It's been amazing. I just would like you to know that this was a dry run for something that I think has to happen more. So if you want more education, you're gonna get more education. I was looking for a format. I don't know if Zoom is ever gonna bring in those unreachable parents and people out in public, but I do know that if we post this on our website, and I know what gets around town is word of mouth, so I'm hoping that maybe if we keep this approach where we're recording the information and posting it where people can go to it after the fact, or a friend can say, I went to this, and so I mean, I'm hoping that we can start to engage more people, and I just feel like we have to start bringing the education. And when we talk about cell phones, we have to, one of the things we're going to look at and focus on is going to be online predators and kids on their phones, because they can actually lose a life to an online predator, and you wouldn't believe it, but it has happened, and that has been close to me. A hockey player basically got sabotaged or abducted on his phone and threatened that his parents were being held, and within 45 minutes he had done something sensitive that he couldn't face telling his parents about. He committed suicide. That's an online predator situation. So we're dealing with a lot of things, right? And cell phones are dangerous, and parents do need to understand that they need to know who their kids are talking to and when. So I just want you to know that there's going to be more of this. If you want to work with Siobhan and I, if you want to work with me to move forward on this, I would like it to, I'm looking for a format where we can bring people like this together and have people come in on Zoom and make it so that people don't have to travel everywhere, but more people can have access through Zoom. Great.
Yeah, I'm just wondering, maybe, can we maybe have a sign up sheet so we can leave our addresses? So if you have any other functions in the future, you
Sure.
can get a direct email.
I have paper, Donna. It's not lined, but
And really, thanks for everybody for coming out. For us, I think it's important, I can speak for us, to be hearing community, right? Because we do a lot of background research, do all this stuff, and look at the numbers and data and blah, 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 blah. But how it's implemented is what matters, and hearing about community is the main piece. And so thank you for showing up. That makes it worthwhile for us, and it's really important for us to get the feedback and diverse information. So thank you.
so if we want to get I think,
Yeah, people can network, right?
yes, and the contacts, are they on the?
They would have had to register.
Yeah. Oh, they had to register to,
Yeah,
oh,
that'll-
get that.
Or on Zoom.
Do they have to register to see our recorded?
I don't know, that's a.
Oh, okay. Anyway. Okay. All right. Thank you, everyone.